Hi, this is Dr. Donald Pelto. I just want to talk to you a little bit about bunions today. This is a big question I get from a lot of my patients. As you can see, really they want to know what causes bunions and how they can treat them. So let's start out talking about what a bunion is. A bunion is this bone that happens to form on the outside of your big toe joint. This is called your first metatarsal phalangeal joint, and this toe that kind of curves over, this is more of an advanced bunion that's actually causing the second toe to become injured as well as it lifts up. If you look on the side here, this is a picture of a bunion that has had surgery on it, and it's restored to the normal position. So just start talking about bunions. What causes it? It's usually caused by some type of a mechanical instability. Either your foot's unstable or your tendons are pulling harder on one side more than the other. It tends to get worse over time. A lot of times people ask me, well, is it due to the high heels that I'm wearing? And I always tell people it's not always due to the high heels, but many times it's hereditary running in the family, and the high heels and tight shoes can contribute to it. So those pointy shoes that you wear can really contribute to the things. Okay. How do you diagnose it and treat it? Really what we do is we only treat it, first of all, if it's painful and problematic. If you're a young lady, we tend to wait till you're skeletally mature, and that's after 15 or 16 years of age. And then we get x-rays. As you can see on the x-ray here, there is this area right here is actually these two bones right here. Let me just show you here. Let me just draw a line. Here's one line right here, right? And then there's another line right here. So this is called the first intermetatarsal angle, okay? And what we want to do is we really want to make these parallel. So if you look at this one afterwards, they should pretty much be parallel, and that's what we're wanting to do. And that's what the bunion surgery does. Another way of looking at it is if you look at these two little bones underneath here, this bone and this bone, and then this bone and this bone, we try to bring that back over, and so they're realigned underneath those two bones there. Okay. Okay, let's go on and talk a little bit more about the non-surgical treatments. So this is what people usually want to know is, well, how can I treat this without having surgery? There are some things called smart toes. You can try to do this to help realign the soft tissue around the area, but if it's already affected the bone and the joint, it's not going to be as effective. If you have a big bump on the top of the foot or on the side of the foot, you can try alternate lacing styles with some shoes, trying to get a pair of shoes with more of the mesh on the side, because there's a seam that can tend to injure things there. And as well, these different types of pads on the area, these can help the area. Icing as well, Motrin. This is a gel Kyano, that's a type of shoe that I recommend. And sometimes injections, a cortisone injection, if there's a inflamed bursa. A bursa is a sac of fluid, usually that's on the side here, or there can even be a nerve that's irritated called a neuritis. That can help that as well. Orthotics, a lot of my patients with bunions, by reducing the abnormal movement of your foot, especially the pronation and the flattening, it can help. It can reduce the progression and provide support to the foot. A lot of times I recommend this more for younger people that have bunions, just to give them more support so they're not pronating and flattening out as much and causing the abnormal pull on the tendons. The reason I put this hammer toe surgery information in is because many times you have a bunion, but you also have this second toe that overlaps, and this may be a hammer toe, which is a curvature right here, and that needs to be fixed a lot of times at the same time. It's beyond the scope here. We'll go do another video another day about some of the other conditions that can happen. But suffice it to say that a lot of times you have to fix the bunion, but as well fix the hammer toe, and sometimes you even have to shorten the second bone right here. It's called a Weil osteotomy, but we can talk more about that later. On this video that's going to be attached, or this PowerPoint that's attached, there's a little video in here, and to watch the video you pretty much just click play, and it'll play that video for you. Okay. It's showing how to do an Austin bunionectomy. This is something from YouTube. You can certainly watch. I turned down the volume just so, and so it really goes in the surgery. What you do is you remove the bump on the side, okay, and then you have to shift this bone over, and that's you do the cut. That's called a chevron cut, a V cut. Once you shift it over, then you can put a screw in the area to hold it in the right place, okay, and then some type of a pin. We don't use pins anymore. We tend to use more screws and different types of hardware. Here's the before, here's the after, here's the kind of the screw that goes in there across that area. Another type of bunion surgery is called a scarf bunionectomy. Once again, if you wanted to watch this, you can just click on the video and it'll go through and talk about the scarf. The main difference with the scarf is that it does a kind of a side cut and it shifts it over. So you do a side cut and it shifts the area over there. So you do 2 cuts instead of 1 cut. So you look at this kind of a V cut right there, and you shift that over. Remove the bump first, and this is for a kind of a larger bunion deformity. And you shift it over. That's your cut, and then you realign the bone, and then you put 2 screws in. So that's a pretty effective way of correcting this. And then the last one that I like to go over is more of a lapidus. That's if people have more arthritis here on the bottom. If you have arthritis on the bottom, you may benefit from this type of a surgery. This is where you actually fuse the base of the base right here at the metcuneiform joint. And the way you can tell this is when you look at someone's foot, if they have a lot of extra movement in that area, and especially arthritis down here, hypermobility, that needs to be taken out, and then you put a couple of screws across there. This the further back you go in the foot, so we talked about the one in the head, shaft, and then the base. The further back you go, the longer the recovery process, and the more time not weight bearing on the foot. And if you're interested in learning about surgery preparation, just click the link on the bottom here. This actually goes to a little document that I put together on Google Docs, and it has this information about surgery where I talk about before your surgery, everything that you need to do, the preoperative visit, during the surgery, after the surgery, and different types of splints after the surgery, what you have to do, how we keep the thing off, and how you move the big toe joint after. This is an important video to watch. And then just really the after surgery schedule that you can watch there. Okay, some of the complications I'll go over, and then any of the common questions that people have. So I really hope this helped you learn more about this, and if you want to learn more, just go and follow the other information on my website, drpelto.com.